Hi, I'm Karen Hammond with Innovative Fertility Specialists. I prepared this video to assist our patients in feeling comfortable with administering human chorionic gonadotropin, or HCG. You may have been prescribed this medication to help to trigger ovulation or to cause the eggs to release from your ovaries. When you receive this medication from the pharmacy, it'll come in a box like this, and it'll have some instructions on there saying you don't have to refrigerate it and don't shake it up, a few other things. But you just open up the box, and inside you'll find two little bottles. One bottle has a liquid in it, and the other bottle has just a little bit of powder in the bottom. It may look like it's loose powder, or it may look like a little cake. Either way is perfectly normal. We're going to start by assembling our supplies. So we'll have these two bottles taken out of the box. The next thing you're going to need is a syringe. Usually a 3cc syringe is sent with this. And the way I open it, if you look at it through the cellophane part, I just turn the cellophane away from me and push the top of the syringe into the paper, and it just tears right out. Remove the syringe from the wrapper, and be careful not to touch the very tip. The next thing you're going to need is a needle. Usually it'll come in a pink package. There'll be two needles that are supplied. One is to mix it, and the tiny one is to give it. You'll definitely know the difference. So the one in the pink package, you can just push the cellophane side of the needle straight through the paper, and it screws on the tip of the syringe. Once you do that, you'll carefully remove the top from the needle, take the bottle that has the liquid in it, and then just pop off the top. It just slips right off. Taking care not to touch the top of the bottle where the rubber stopper is, or the tip of the needle. You want to put the tip of the needle directly into the middle of the rubber and draw out about 1 cc. And you can see where the 1 is on the syringe. Doesn't have to be exact, but just about a cc. Then remove the needle from the bottle stopper. The little liquid squirts out, that's not a problem either. Then take the bottle that has the powder in it and just snap off the top. Sometimes you'll hear a little click. Taking care not to touch the tip of the needle or the end where the rubber is. Just put the needle directly into the powder bottle, squirt in all the 1 cc of the liquid, and just swirl it around a little bit. You'll find that it dissolves instantly. If it looks cloudy or has any particles in there, you're not really supposed to use it. Honestly, I've never seen that happen. So once you swirl it around a little bit, you can just keep the needle inside and look right here at this part right there. You'll see that you can see the tip of the needle inside it. Just make sure that you can also see the tip of the needle in the rubber stopper. So I can turn there and see it right there. You want to make sure that you see it, that it's completely inside the liquid. And you can turn it to the side just a little bit if you like, and just draw back all of that liquid. Once you have it all drawn out, you just pull this out, and you're ready to change the needle to put on the tiny one. You're not going to want to give yourself an injection in your belly with that big needle. It just snaps right on, and just like you screwed it on, you screw it off this time. Take the needle that's in the smaller needle that's usually in a gold or a gray package, and you want to look at the cellophane side and just push the tip of it straight through the paper and screw it onto the needle. Now it's ready to give. Once you have this done, you want to, if there's any air in there, you can thump it and push it out. There shouldn't be much, if any, air. But you'll be able to see it. There's some air in there now, and you can just push it up to the top. I try not to push all the air out because a teeny little bit of air, maybe to the first line on the syringe, will help make sure the medicine seals inside your injection site. Next, you want to just take the top of this needle off, and you see this one's much smaller. You might not even can see it behind there. You'll take the top off, and you'll prepare an alcohol prep just by taking it out of the package. The site that you want to give the injection is going to be in your belly, beneath your belly button, and out to the side an inch or two. And you just want to find the site, wipe it with a little alcohol. I'm going to use this little dummy thing to demonstrate it. We're going to pretend this is your belly. Just take the alcohol prep. You can just wipe one time. You don't have to scrub or anything. I bet you take a shower every day. And then when it's time to give it, you just put the needle, you pinch the skin just a little bit, like that, just a pinch an inch. Put the needle directly into the middle of where you're pinching, straight in all the way, and then push in the medicine. Once you've pushed it all the way in, you can take the needle out. The syringe should be empty. Let go, and you've done your first injection. Usually doesn't bleed at all, but if you have a little drop of blood or even a drop of fluid come out, that's all right. You can just wipe it again with the alcohol and maybe hold pressure there just for a second, but it's not going to last very long at all. Just like that, you've done your first injection. Congratulations. Now it's time for homework.